Hello, everybody. I'm here with Nicole Bijlsma, and we're going to have some conversations on mould and mould-related illnesses. Nicole's the founder of the building biologist industry and Healthy Homes Australia. So welcome, Nicole, and thank you so much for doing these talks with us. Can you tell us a little bit about how you got into the industry?
Sure. Two events that happened in my life that may change the way in which I looked at adverse health effects. I was working as a naturopath and acupuncturist at the time for around 15 years, and I noticed very strong correlations between many of my patients' illnesses with asthma and allergies and fatiguing syndrome, especially autoimmune diseases. And many of these patients, by the third consultation, will be talking about the mould. What do you think of the mould in the bedroom? What do you think of the mould in the house? And I go, well, I actually have no idea. I've never, in 8 years at university, we didn't cover mould. And but it wasn't until I moved into our home, our first home we bought in Warrandyte, which is a beautiful area. It's the closest state national park to the city of Melbourne. And when we moved in there, within days, we both experienced sleep disturbances. Within 12 months, I fell pregnant and subsequently miscarried and had 10 miscarriages in this home. And I really started to examine how the home could be impacting human health because of my own health issues, and realised we were sleeping near a meter panel, so high electromagnetic fields. There was traffic-related air pollutants from the nearby T intersection, which we live close by. So the noxious gases, carbon monoxide, carbon dioxide, were triple in our master bedroom. I had a dowser come through who picked up significant geopathic stress directly beneath the master bedroom, and Parks Victoria used to come and spray our blackberry bushes. So I really got it from all onslaughts. I couldn't see or smell it, and it was like a B&B. It was lovely, but realised that there was actually a lot going on. And when I looked at the literature, I was shocked how much information was available on indoor air quality, even 25 years ago.
And so how do you identify a mold-related illness? Like, obviously you were seeing these illnesses in your patients. Can you just give us a little bit of a list of the classic short-term symptoms? If somebody's been affected by mold and thinks maybe I do have a mold-related illnesses, what symptoms will they classically see?
The first we're looking for is recurrent colds and flus. So flus and colds that take forever to get over. They're unresponsive to treatment, both naturopathic and medical, antibiotic use, and they keep coming back. And the timing of exposure. So it happened when they moved into this home, or it happened after a flood event, or it happened after a renovation where they exposed, opened up a wall of hidden mold and contaminated the whole house.
Or they feel better if they leave the house. Like if they go away on holiday, all the symptoms get better. That's a classic one as well, isn't it?
Definitely important. So upper and lower respiratory tract infections, hay fever-like symptoms, runny eyes, lots of lacrimation, congested or runny nose, cough that's persistent in the lower respiratory tract, pneumonia. I see a lot of patients with pneumonia that are often hospitalised, and often the timing of exposure happens when they're in this home. And as you said, they get better when they're away from the home.
And so because we've recently had the floods in this area, we do have a lot of patients living in water damaged houses at the moment, and a lot of little kids. And the parents seem to be okay, but the little kids are just getting these reoccurring sinus infections, sore throats, earaches, lung infections that just won't clear up. They're also getting a lot of tummy issues as well. So diarrhea, bloating, just off their food, not wanting to eat. And it's interesting for me, I see sometimes the parents can tolerate living in this environment, but the little kids don't seem to tolerate it as well. And there'll always be one or two in the family that's just not doing well, and some of the other kids in the family maybe are fine. So not everyone gets sick if they're living in a water damaged building. Can you explain that phenomenon?
Sure. Well, with children, they have higher hand-to-mouth ratio, so a lot of the fungal particulate or spores and hyphae, which contain the mycotoxins, are on the surfaces. So children are much higher risk of exposure because it's on the household dust, it's on the surfaces. That's the first risk. Secondly, they have higher breathing rates, so they're inhaling a lot more of the allergens and the fungal spores than adults would be. And they're, of course, closer to the sources, which is the surfaces, because they're closer to the ground. We also know risk is associated with gene variants or genetic susceptibility, which can significantly increase risk. But the reality is we're all at risk. The ones that don't have the gene profile will have recurrent respiratory tract infections, pneumonia, bronchitis, tonsillitis, very common, especially in kids. That's if you are healthy in a water damaged building. If you're of the gene profile that makes you significantly susceptible to not recognizing those antigens, what happens is you end up with the chronic fatigue-like symptoms or the autoimmune-based disorders as a result of low-grade
long-term symptoms. Yeah.
Chronic inflammation, yep, that's impacting key neuropeptides that ultimately are impacting how you deal with pain. So there's pain throughout the body, like fibromyalgia. Ultimately, chronic infections, whether it's in the vaginal flora, the bowel, the upper respiratory tract infections. It's like mold in these patients is like chronic infections throughout most parts of their body that's resulting in metabolites. It's impacting detoxification profile. So they end up with chemical sensitivity, the electromagnetic sensitivity, and mental illness, which is due to the environmental exposures.
And the neuroinflammation that comes as a result of the toxic byproducts. So, you know, I see a lot of patients, obviously, because in this region in Byron Bay, it's got a nickname called the Mould Bowl. And so we do see a lot of it. And you know, I'll have patients coming saying, do I have a mold-related illness? So some of the testing that I classically do, I still use the visual contrast screen. Do you?
I love that test.
Yeah, okay, you do. I was curious if you still do use it as well. It did go out of fashion, but I think it's a beautiful diagnostic. It's online. It's, you know, just a $15 test and you can test efficacy of treatment as well. So if somebody fails the test pretty badly, and then we start treatment and they start to be able to pass the test. So I like it for that because it's a good scale to see if what we're doing is actually working. I'm also using a lot of the naturopath mycotoxin testing. If we get to a point where we go, I don't know, is this mold? This could be other things. It will generally tell me if somebody's got those toxins in the environment, aflatoxins, ochratoxins, and then I can kind of understand which mold they've probably been exposed to and how to best mop those toxins up in the system, which we'll talk about in further talks. Is there any other testing that you like to do, Nicole, in terms of just identifying, is this a mold-related illness? Would you do pulse diagnosis? Like what's your go-to if you're trying to help a person recognize if they've got a mold-related illness?
The most important will be the environmental exposure history. So the questioning is going to be the most critical. So looking at the timing of exposure, what was going on in their lives at the time this happened, like you mentioned, did they move in the house? Did they get better when they're away? Did it happen after a renovation? Have they moved water damage contents to the next house and they're still sick? Do you know what I mean? These things are, the environmental exposure history is the most important clinical tool. And I published information on that in 2016 in the scientific literature. The VCS test I love as a screening tool. It's not diagnostic, but it's brilliant because patients can test positive on that very quickly after exposure, like the same day. Yeah. And this is what I use for my building biologist and mold testing technicians. Test yourself regularly. If you've had a really bad job, test afterwards and you'll probably come up positive because it was so bad. And ironically, it was developed by the US EPA in aviation, for aviation pilots. But at some point in the 70s, it was actually used as a screening tool for multiple sclerosis, believe it or not.
Oh, yeah. The neurotoxicity. So it's measuring, what's it measuring? Visual contact? It's
actually reduction in blood flow to the optic nerve. And of course, because the optic nerve is an extension of the central nervous system. So I find a lot of patients in women in water damaged environments that end up with MS diagnosis that I think it's not MS, it's probably mold exposure. The environmental exposure history gives us good clues as to the timing of the exposures. So I love the VCS test. It's just a screening tool. It could also represent chemical exposure, so it won't differentiate between fungal particulate and biotoxins, of course, like tick-borne illnesses, etc. But it's definitely a great screening tool. Other tests that doctors will often use are the inflammatory markers, you know, BIP and MMP9, etc., and MSH, etc.
And the C4A, they're good tools too. Yes, and I do use them as well. But I do love the straight mycotoxin testing. If we've got mycotoxins being measured in the urine, that's a pretty sure thing. And the visual contrast screen, the biotoxin cluster questionnaire, do you use that one much?
Yes, absolutely. In terms of diagnosis of a biotoxin-related illness, for sure. And nearly every one of the clients we're dealing with often have a history of tick-borne illnesses or previous history of water damaged exposure, either at the workplace, in the car, or the home. In nearly everyone, it's almost like it's primed their system. It's rare to have someone for the first time in their life be in a water damaged environment and cause chronic fatigue-like symptoms.
Right.
They have a history of exposure when they look back at their childhood or work history that they've been exposed.
Yeah. Okay, that's fantastic, Nicole. So what I might do is leave it there, and the next part of the talk is going to be on how do you remove mould and prevent it from returning. Thank you for joining us.